So our last speaker, last but not least, that's for sure, is Ruth Pelletier. Ruth's professional life and her volunteer work have always been her striving to make a difference in a good way for people less fortunate. For close to 60 years, Ruth has been involved with welfare rights, anti-poverty movement, consumer protection, working in geriatrics, the media, English rights, and on health and housing issues. She has worked or advocated for such organizations as the Ville Marie Social Service, Alliance Quebec, and is a founder of Senior Action Quebec.
First of all, let me thank you for inviting me. It's certainly been a very informative morning, and I really had a lot of things reinforced, and I also learned that there's a lot of work going on and very positive and forward moving, and nice to hear about it. And I was thrilled to hear Janet's presentation as well. A lot of what I'm going to say, you've probably already are doing it, you've heard about it, but perhaps some don't, haven't considered it, or a little refresher. So basically your event is called Call to Action, and I was asked to talk about have an issue and how do you move it forward. So first of all, the thing is to identify what your need is. And I think you clearly all are on the same path. It's to have safe and inclusive housing for all communities, and including diverse and cultural needs, sexual orientation. And in order to do that, we'll start right at the very beginning. You have to have committed volunteers and supporters with them, and we'll talk a bit about making sure you've got the good ones and how to bring them on board and buy in. You need to build your case for support all the way along, and that can be the causes and consequences of the issue, and taking into account, which one of the ladies spoke about this morning, that within Canada and Quebec, we have rural, remote, we have urban settings, and we have suburban set regions. And the resources and the needs vary, and there's no one size fits all, and we need a variety of housing. And we certainly had a glimmer of the different options that are out there just now in this session. You have to have the hard stats. Wherever you're going to implement policy or bring attention to a cause, you've got to have the evidence-based. You have to be able to say how many individuals are affected. You have to be able to promote or the selling pitch that costs financially to society and the system if it's not changed, if nothing is changed. What's it going to cost the broader community? Next slide. You have to recruit good partners. And when I say that, you need the community players, you need key stakeholders, you need the individuals, probably number one, that are affected by the lack or the service or the challenges that they're facing. You have to have community partners such as organizations, cultural communities, the homeless, native centers, and the list goes on and on. You have to have the owners, managers, staff of the residences, the long-term care facilities, the organizations that are providing caregiving services involved, church leaders, researchers, universities. I mean, a lot of universities are doing research on housing. I can tell you Concordia can, with Patrick Marnier has been involved with housing for a number of years. The webinars and conferences, focus groups and surveys. You're doing a conference today. It has value. You're getting the word out. You had politicians here today. So you're beginning, you're not saying that. Generally, that's a step in order to sensitize and get the word out. Your media are your key supporters as well, and including print and electronic is your social media. So you need that expertise and the way to get around that. Your policymakers, of course, are your government. And when you're talking about housing, it gets even more complicated because you're dealing with 3 levels of government. It's not just one. You've got the municipal, who have their own local bylaws and regulations and zoning. And you have the provincial, which has its standards. You have the federal, which has put in massive amounts of money into a national housing strategy. They've got ententes with the provinces. So they have a say in it. One thing I will flag to you all, that Humaine Hussein, the minister of the housing file, social development, families, etc., is very, very sensitive and a very, very good friend to have on your side. He was an advocate. He was an activist in his previous life. He is a lawyer, and he seems to zoom in when you talk to him and you just express needs and challenges and right down to the grassroots level. So I would say he's certainly a player. Your CIHR, Canadian Institute on Health Research, because poor housing, lack of decent housing has a definite impact on people's health conditions. And your Health Canada. Next slide. Also, next slide. You should also include or have a concept to include some of your guiding values and principles. Now, I drew this up on a very broad spectrum, but you can tune it and zoom it in for your specific needs. Self-determination, including respect and dignity. Participation, independence, and choice for the clients. Fairness and equity, the relationship and the social inclusion. And of course, always security. We must always ensure that we have accessible, adequate, and affordable housing for all. It's a massive, massive need. It has to be person and relationship centered. There's got to be training, and I forget who it was, did talk about training before, and it needs to be in the nursing schools. It needs to be sensitizing caregivers. So these private companies who offer caregiver services, social work, School of Social Work, when they're training psychologists, we have to have the training and the support for these individuals. And it needs to be ongoing. It needs to be refreshed. Diversity and cultural inclusion, of course, it has to be enhanced and expanded upon. We should, comprehensive, it should be expanding activities, services, promoting participation within the establishment that you're hoping to create. Integrated, flexible, seamless. And there always has to be the consideration of mental health. People's mental health is absolutely key. It's the trend, it's the buzzword for all the governments these days. We know that, especially with COVID, the isolation, the lack of human contact, feeling like you were a prisoner, that you were being dictated to, that you could not go out, you could not have visitors, although it might have been for your own health, had serious anxiety, depression, impact on seniors. I mean, COVID has affected all sectors, but seniors, and people say, oh, they're just tired. They're having a bad day. They're tired. They're grumpy. They're in pain. They didn't sleep well. No, sometimes, and a lot of times, it's a lot worse than just not having slept well or in pain. So when you look at the current situation with housing for the LGBTQ community, and it's the same with heterosexual communities as well. You can be partners, married, and been together for 40, 50, 55 years, and one partner becomes ill and has to go into a different type of home. I hate calling them long-term care facilities, and I hate calling them residences. And they can't take their partner with them. The implications, the anxiety, the stress, the disconnection The social isolation impact that causes is unbelievable. And it's no human being should have to endure that. So these are something that we must always consider and build into any policy change or any situation, or you're having something built to your norms or whatever. And evidence-based, so that way you can justify what you're asking for, demanding is legit. Next slide. Now, of course, it's very important to make sure that your team or your supporters, your volunteers are all on the same page. So you have to be well informed of the issue, because you can have supporters who are not from the LGBTQ community and they may be supportive, they may understand to a degree, but if they're not living it, they may not know it all. So you've got to make sure that people are sensitive and well informed. Find out the strengths of your volunteers, because each one can play a specific role. I strongly suggest with any organization and any issue, massive issue that you're taking, and especially if you're going public, that you have one designated spokesperson and you have a backup person that should something happen to your original and they're not available, you're covered. And what that does, it avoids the mixed messages, and it also lets the media know who they should be approaching. They get to know each other, and we know that we have to go to David or we have to go to Bruce to get our information. And I'll warn you, and Janet and I have both worked in media, but I've done producing and researching where I've been as guilty as the next person and said, I absolutely need to speak to the person immediately. It's really, really a hot subject. Take your time, get your facts, find out what kind of interview, how much time you got, what are the key subjects they want to interview you about, because they can wait. Next slide. How to make your case stronger. It's always good if the timing is right to hold a joint conference with other key community players. That gives you strength in numbers. It's more forceful. People and media and the public will take more notice of it. Use your social media. We know how that has impacted on elections, how it impacts on demonstrations. So they're a good tool. Hold the conferences like you're doing today. It's a way to get your message out. It's a way to raise awareness, and you won't lose. Lobby days is something that's very valuable. Have a uniform script. Train your participants and your volunteers and everybody. You take 3 people, let's say, and you're going in to meet every M&A on one specific day. So you've contacted the key agenda person for the CAC party, the Liberal Party, Solidarité, the PKIST, whatever. And you have 3 people that are going to meet with each M&A, whether they're in office or in opposition. And you have a common message. 2 are the spokespeople, take turns asking, and that's already pre-designed. And you have 1 person who's taking the notes. It's a massive undertaking to schedule, but you're covering the entire provincial government scene the same day with the same message, but different individuals going to different people. And like Bruce, David, and Ray, let's say, may meet with 4 different M&As. And Johnny and Susan and Carolyn will meet with another different 4. It doesn't mean you have to have so many volunteers that you're only meeting with 1 M&A. Petitions and letter writing campaigns to M&As and MPs, always good. Waste a few minutes of your time perhaps, but it's worth it. And this is where you use the expertise of your different volunteers. And don't forget your letters to the editors. Your goal is to promote support, not cause nasty and negative reactions. So if you're doing a demonstration, you have people who are going to be on your side taking care of security. You keep moving, you don't block traffic, you don't cause disturbances, you get the necessary permits, you do it all legitimate, and you don't have anybody angry at you from the other side. So I would strongly suggest that. Next slide. Things that we rarely think about, but we should, and this is what's building your foundation. Identify the role and the responsibility of your volunteers. Volunteers want to feel good about their experience. They're there because they have something to give and they want to make a difference. But at the same time, they want to feel good about that experience. Also, everybody in the group needs to also realize that the executive and the board of the organization have a major role in ensuring that, but also that they themselves are volunteers. Provide an orientation annually for all, and especially new volunteers and new board members. And David Cassidy can vouch for this because he helped, well, he did it, it was his idea when we were involved with Seniors Action Quebec together, have a clear agreement job description so everybody is on the same page. Every committee, and you know exactly what's expected of you. Next page. The role and responsibility of the volunteer, and that includes all of us. Regardless of what organization you're with, it's anticipated that you're going to honor your commitment. So if you say you're going to give 1 day a week, please do 1 day a week. Honor the time you said you would donate. No job is too small. Anything you can bring to the table is essential in helping the organization move forward and continue its valuable work. It can be preparing coffee, answering the phone, greeting members, writing articles, doing research, fundraising and event organizing, driving people to meetings, preparing documentation for meetings, all has a value. I see I'm getting, next page, making certain they have all the information and training in order to succeed. Provide an environment as you would a paid employee. Respect volunteers' commitment and boundaries. Make sure you're able to offer them self-care so that you don't have people burning out on you. Next page. Results, success. Set your goals, develop your action plan, your actions, your timeline, and who is responsible for doing it, and monitor it on an ongoing basis. With a strong foundation, a team working on a common goal, a worthy cause with a strong case for support, you will succeed. I don't know if I've got time for this, but I threw out in the next page an example to show you that skills can be transferable. Pick addressing social isolation. And one of your arguments, possibly, or several of your arguments could be, it's less costly to the healthcare system if you address it. Individuals themselves who are suffering will experience a better quality of life. It has benefits to families and society at large. Less stress on the families, less homelessness, crime, aggressive behavior of some, less need for first responders in some extreme cases, and a sense of contributing and making a difference for volunteers and their families. So if somebody feels they're participating, they have a sense of belonging, they're appreciated for their values, you're going a long way forward to improving that person's outlook on their personal life and taking away the social isolation. That's it. I thank you very much.
Thank you, Ruth. It was very informative, and you are a very verbose kind of speaker with everything going on. So it's a lot of fun. Thank you. As part of the title of the conference states, a call to action, we want to advocate for safe, affordable 2SLGBTQIA plus seniors housing for all of our community. There are 2 major housing developments presently being planned and developed right next door to the Gay Village in Montreal. The site of the old Radio Canada building on René Lévesque and the site of the former Molson Coors building on Boulevard Notre Dame. Dedicated housing for our seniors community on one of these sites would be a start to resolving the many issues discussed here today.